I've seen a crowd lean in to learn. A mother asking what her choices mean. A classroom where a simple lesson turns a worried face into something bright and clean. That's the work, the quiet kind of change. One message shared and suddenly a whole community starts to see. Reach out with health, reach out with hope, changing hearts with every show. From the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with health, let's make tomorrow safe.
Yes, it's another beautiful Wednesday, and welcome to Health Connect Forum. We're live on Municipal 95.3 FM Abuja, and we're relaying on AMAC 88.5 FM Abuja. I am your host, Imo Ebong. Well, this program is proudly supported by Reach Out Health Awareness Foundation, ROHI. In case this is your first time of joining us, Health Connect Forum is a public engagement platform designed to connect development partners, healthcare stakeholders, policymakers, NGOs, INGOs, and communities through informed conversations around health, development, governance, and social impact. Our goal is to create public understanding, strengthen accountability, and encourage sustainable solutions that directly improve lives across Nigeria. Today's conversation is both timely and important. For decades, Nigeria's healthcare and development sectors have benefited significantly from international donor funding and development partnerships. From maternal health care to HIV response, immunization, nutrition, humanitarian support, and community outreach programs, donor-backed interventions have shaped critical parts of our national development landscape. But across Africa, things are changing. Global funding priorities are shifting. International aid structures are evolving. Governments, NGOs, development institutions, and local communities are increasingly being forced to ask difficult questions about sustainability, ownership, accountability, and long-term resilience. How prepared is Nigeria for a future with reduced donor dependence? Big question. What are the biggest challenges currently facing development financing? And where are the new opportunities for innovation, local ownership, and sustainable growth? That is the focus of today's discussion. We're looking at development funding in Nigeria, challenges and new opportunities. Joining us on the show this morning is Mr. Joshua Ida Samson. He's a respected strategy management and development consultant. He's had experiences supporting several USAID-supported projects and development programs across Nigeria. Mr. Joshua, good morning to you, and thank you for joining us.
Thank you very much. Good morning, Nigeria. It's a pleasure to be here.
You're welcome.
Part of this beautiful program.
Thank you, sir. All right, so time is of the essence here, so we will maximize every bit of it. Let's jump into the questions now. From your experience across development interventions, how would you describe this current state of development funding in Nigeria today?
Nigeria, like many other poor resource countries in the world, have benefited from development funding as far back as during our independence. And that had targeted several communities and several development sectors in the health, HIV, agriculture, nutrition, and what have you. And that has come along several decades. Okay. Now, in 2026, with the experience of what USAID challenges and dismantling, we are facing critical situation and gaps in the development funding for Nigeria.
Okay. Well, quickly, how deeply embedded is donor funding within Nigeria's healthcare and social development systems, particularly at the community level?
For a long time now, the development funding in Nigeria, particularly in the health sector, has been largely, our health sector has largely benefited from development funding and dependent upon funding that comes from USAID, DFID, and other funding pipelines. And to a great extent, we have relied on those funding for our collective existence, for good health. And now that the funding are shrinking and fading away, we have come to a point where we need to think critically about managing our health.
Okay, I'd like to pick from what you said, dependence and benefit.
Yeah.
You know, it is one thing for you to be sustainable.
Yeah.
It is another thing for you to benefit.
Yeah.
And it's a different ball game for you to be dependent.
Exactly.
How would you describe Nigeria's position until now? Have we been benefiting or dependent?
We have been benefiting and depending. As far back as 1992, when I worked with USAID health project, we discovered that if USAID does not provide funding, then nothing works in the ministries.
Was it that bad?
Well, because of the scenario created that we were resource poor countries, and therefore our health programs will be supported. And there were budgets line provided by USAID to support that. And then the ministries that were supposed to be responsible for managing our health with funding from government, those fundings were not forthcoming. And so the development funds had to fill those gaps. That is how bad it was. Because if the funding doesn't come, then the health issues continue to remain.
Okay, so let's narrow down. What major global shifts are currently affecting development financing, not just in Nigeria, but across the continent of Africa, and, you know, dealing a blow on countries that you have just described now, such as Nigeria, where we create this impression that, oh, we need help, we need support. Does this support really get to the people? But first, let's deal with how is this impacting, this whole shift, as you mentioned. How is it impacting countries like Nigeria across Africa?
We woke up into 2024 and to 2025, and Donald Trump dismantled USAID. The dismantling was like a wake-up shock to many countries that had depended on funding from those instruments. And the impact is at the grassroots level. Communities and individuals that hitherto were benefiting from the development funding. For example, in HIV, when funding for drugs had stopped, the implication is we might have people who are supposed to be on drugs and who will not be able to purchase the drug because the funding for drugs were coming from USAID pipeline. So then it created a momentum for us to wake up and said, how can we manage our current situation without the dependency that over time we have continued to be to benefit from? So that's the wake-up call, and that's where we are right now.
No, you mentioned just Donald Trump. I mean, I'd like to refer to it as Hurricane Trump. You know, is that the only thing or the only challenge, you know, impacting development funding across Africa, particularly Nigeria? Are there any other challenges?
Yes, it created a ripple effect. What Donald Trump did created a ripple effect among the various mechanisms for development across the globe. America has been carrying the burden of development responsibilities for the United Nations for other resource poor countries. And the guy came and said, hey, enough is enough. Countries should take responsibility for their own programs and for their own health. Because we were not prepared for this. You see, when you going begging and there's something is always coming, there's a tendency to be so dependent upon the person that you are begging from, that one day when he says, say enough is enough, you who is the beggar, you just get shocked. What have I done wrong? And I think we are at a point where we need to say, hey, what have we been doing wrong in depending on development funding? Because Nigeria is not a resource poor country as we were tagged over time. Nigeria is rich with abundant resources, but we have not been careful to manage what we have for our own full benefits.
Now, two things. You know, there's a place of what have we been doing? What have we been thinking?
Yeah.
You said this Hurricane Trump surfaced sometime in 2024 when America made that decision to say, look, you must take responsibility for your people. You must take responsibility for your development. So between 2022 or 2024 and this is 2026, we're talking elections. What has happened? All the people who were beneficiaries of these projects, these fundings, what is happening to them? Do we see efforts by government to close these gaps? Or indeed, Nigerians and members of our community, our respective local communities, are just left on their own?
Unfortunately, many NGOs, CBOs that have worked with development organizations over time have been caught stranded because many of us don't have sustainability strategy to grow beyond development support. And unfortunately too, the government of Nigeria, and I'm sorry to say this, we have not been thinking strategically to win ourselves off the apron of development funding. We thought development funding was going to continue forever, and development assistance is never forever. It's for a while. And of course, when they come and give you funding, they prescribe what you must do with the funding and how it must be done and for how long. And then, unfortunately, too, we have not learned from them how to manage the funding that we get and be accountable for it. So these are some of the challenges that those of us in the development sector have experienced over time. And as far back as 2004, I kept on saying that unless Nigeria wakes up and takes responsibility for managing its own funding and its program for health and education and all others, a time will come when funding from USAID will stop. It's like a prophecy, and it happened. It happened. So we have this challenge, and now it is.
Yes.
Our political leaders need to create a think tank that can help us think through the various strategies that must be in place to manage our resources for our collective development, both at the national and the grassroots level.
Indeed. Well, there's so much to talk about. Very importantly, you mentioned that you foretold of a seizure of this funding one day.
2004.
2004.
Yeah.
Why do so many sectors still struggle? Is it that they didn't hear your warning? Is it that they didn't know that, there was no plan B?
Yeah.
Should anything happen to this stream of income or funding rather? What's the plan B? Because it looks like a lot of organizations are shutting down.
They are shutting down. And that is because for many organizations don't think futuristic. if tomorrow comes and where I'm sitting collapses, will I collapse with it? Or will I rise up? Will it be a cushion for me to rise up? Sustainability is one factor that we have never built into our strategic plan in the development sector. We do strategic plan for 5 years, we get funding for it, and we hope and anticipate that additional fund was coming. But then, if that funding stopped, we didn't even plan at all that we will survive beyond what we are getting. That has been the challenge that I noticed in 2004. From that time, I began to build some capacity of some NGOs to build sustainability strategy into their strategic plan, so that creates a kind of a plan B and even a plan C. In the event that funding ceases, you don't pack up and just go home. You continue to do what you're doing. And that cut across virtually every state of Nigeria, unfortunately, where development funds supported NGOs, and then many NGOs right now are closing down. Our various structures that were put together with funding from development opportunities cannot be sustained because we didn't look beyond development funding. But now is the time to begin to do that.
Absolutely.
I remembered in 2009, when I talked with somebody in the World Bank, I said it's about time we begin to create sustainability strategy among the various NGOs and networks in Nigeria, so that our total dependency on funding, particularly the Global Fund and PEFA, if Global Fund and PEFA coughed or sneezes, and we say hi, it says jump, we say how high, because our livelihood and the programs that we were supporting and implementing were totally dependent on those mechanisms. We were not ready. We were not prepared. And we didn't think through our survival strategy should those programs stopped. And I'm glad that Donald Trump made it happen in 2024.
Why would you say so?
I'm happy because we are a nation that is so blessed with abundance of resources. Nigeria is one country that you can plant anything, anywhere. It will germinate and grow and you harvest within the season. Go to Israel, they have to do mechanizing of that dry land for them to get fruits. But we're not doing that. Go from Abuja to Kaduna by air, you have large expanse of land for agriculture. In fact, America said Nigeria can feed Africa and the world from her land mass. We don't have organized mechanized farming to support our local farmers. All they do is go to farm, harvest your crops, eat, but nothing on a large scale. Look at Ukraine. Ukraine filled the world with their wheat. Ukraine's landmass is about 1/10 of Nigeria. So we need to wake up and take advantage of the opportunities that God has given to us in terms of resources, and strategically work within our means, not from external support anymore, within our means, to make things happen for our collective livelihood.
Is that doable in the face, or achievable in the face of challenges, myriad of challenges, including corruption?
Corruption is the big...
Because if you say that the incident of 2024 was a wake-up call, it looks like nobody's waking up or still sleeping, waiting. Maybe Donald Trump or America will change its mind one day and continue to breastfeed us.
If you read in the news media, some people are thinking that, well, once Donald Trump leaves in the next 2-3 years, things might go back
to normal.
You see, and that is a defeatist attitude. Donald Trump has hit us on the nose and said, hey guys, clean your nose up and then take responsibility for yourself. Our leaders, the technocrats, the various ministries should have come together and say, hey, this is time to look inwards and strategically put frameworks in place to address the challenges and the gaps that this funding seize has caused. But that has not happened.
Why?
Our politicians are not seeing the future. They are not seeing the future. We don't have politicians who are thinking strategically for the benefit of the common man. We have had several programs, Vision 2030, Green Revolution, Operation Feed the Nation, and what have you. How far did they go? How far did our leadership follow up with frameworks that will make these programs, laudable ideas, work? No follow through. Everybody is thinking about their pockets, and that's where we have failure of leadership. We need leaders who are selfless, who think for the benefits of the common man, and will put structures in place to bring all of us together and work collectively to improve our general welfare.
I'm hoping that before we round off this conversation, we'll be able to put the nail on the head and say, this is where we are. This is what leadership needs to do. This is what the people need to do to ensure that collectively we can move forward.
Yes.
Whether funding comes from outside or not, we can take care of ourselves from within. But the point that you have made here that is salient is that everyone needs to come together and work together. Nigeria is blessed not just with mineral resources. Nigeria is also blessed with the human resources.
Exactly.
There are people who know what to do to solve Nigeria's problems across multiple sectors.
Yes.
But will they find their way to that table? Will they be allowed on that table where they can sit down with the leadership and prefer solutions to local problems? But let's look at this. Let's go down into the bucket. With the cessation of funding, how is this impacting the people directly? Because you talk about HIV, you talk about tuberculosis, you talk about malaria, and the list goes on and on. You are the resource person here. So take us into a deep dive. What does this mean for the ordinary person who does not or may not have access to the quantity or quality of antiretroviral drugs that they had before now? Whose life may depend on it? Someone who's dealing with tuberculosis, somebody who's somewhere who does not have access to a hospital, but an intervention somewhere is saving lives because there's mosquito-treated bed nets. There's malaria medication.
Invariably, is the community that bears the brunt and the burden, and is grossly impacted. Because the benefits that hitherto had come through this development funding are no longer coming. They can't buy drugs, and they don't have money on their own to buy. And even when they scratch their income, the income in Nigeria is so meager that it can't buy what will sustain livelihood. So, bottom line, there's a huge challenge at the community level. The targeted beneficiaries are not living as they ought to live because of those gaps that we are seeing now. Something has to happen. And to nail it on the head, our leaders and technocrats in particular, because we do have people who are genuinely interested in the development of the various Nigerian sectors. But the political leaders are not giving them the opportunity to come to the table for discussion. I remembered when I was in 2014, the President Obasanjo, then he was on the throne, and he needed somebody to to develop a proposal to the Global Fund to support orphans and vulnerable children in Nigeria. He located me to Otukpo because they knew that I was one person who was an institutional memory on OVC response in Nigeria. I came to Abuja, they locked me in Sheraton with 8 international experts. I would develop the Nigerian country proposal to Global Fund in Geneva, and it was funded. But when the fund came, the president meant well, but the ministries were fighting on who will manage this fund. See, that's the challenge we have. Until our various ministries understand the role and responsibility they have, and they have to support the welfare of local communities, we're not going to grow. We're not going to grow well, because those are federal government's arms for development response. And so, when the fund came, I was pushed aside because I was just a consultant.
Oh, wow.
The plan was to support 200,000 orphans in every state every year for 5 years. That didn't happen.
But
money was given and accountability was porous. For me, my heart bled because I knew children whom I thought and hoped that were going to have good life.
Finally, an opportunity. Help
came, but unfortunately, it didn't trickle down to them. And it's shameful because we have instruments for development that are clogged with all manner of, use the word that time.
Well, this is Health Connect Forum, and our guest this morning is Mr. Joshua Ida Samson, a respected strategy management and development consultant. His experience, you just heard what he talked about. It's been an interesting conversation, but we just scratched the surface in terms of how the evil of corruption can actually reduce us to nothing if we're not careful.
Yeah.
So, before we talk about the impact of global underfunding, can we talk about how we are undercutting ourselves? Do we want to go forward as a people or backward? Let's take this as a case, as a test case. Yes.
Yeah.
The funding came. You were pushed aside.
Exactly. Shamefully.
If we are serious, this should not happen
exactly.
again.
And we wonder, I wonder when Nigeria will grow up. There was a time Bongos Ikwe sang a song, will he ever get there? Will he ever make it? Will he ever hear the sound of the cockroach? That was a pathetic situation that Nigeria was going through. The Nigerian farmers were looking for opportunity for growth. The instruments for growth were pushing them further away from those opportunities, and it was like a mirage. And the goals were not being achieved. But those are miles away several years ago. We have learned from failures. We have learned from mistakes. It's about time to bring those lessons together and say, hey, where do we go from here?
Indeed.
In this our age and time. Sometimes I weep and cry. Will my children get benefits for their growth and development into the future? Because I have been in the mainstream of development, struggling along with my colleagues and people whom I think will think in the way I'm thinking, and we are not gelling. So where are the good mindsets that Nigeria have?
This is Health Connect. Let's go on a quick break. When we return, we'll point in the direction of the future, the next steps. What next for Nigeria?
Thank you.
All right, thank you for staying with us. This is Health Connect Forum, brought to you by Reach Out Health Awareness Foundation. The program comes your way every Wednesday from 10 to 11 a.m. If you're an organization, an NGO, an INGO, this platform is for you. Get in touch with us and we'll bring you on this platform so you can get to tell Nigerians about your projects and your programs. You can get in touch with us by simply going to our website. That is www.reachoutwithhealth.org. That is www.reachoutwithhealth.org. Or you can reach us via phone to call to 0703 044 8318. Once again, 0703 044 8318. And you'll get a chance to come on the program Health Connect Forum and talk to us about your programs, your projects, and how you're going about changing lives. Our guest here in the studio this morning as we discuss development funding in Nigeria, challenges and new opportunities is Mr. Joshua Ida Samson, a strategy management and development consultant. Mr. Joshua, let's get back to the conversation. Let's just take a moment and take a peep into what the future would look like. But just before we do that, remember, if you're listening to us this morning, you can join the conversation by simply calling 091 225 96595. You can join the program, ask a question or make a comment or contribution by calling 091 225 96595. Once again, 091 225 96595. Thank you. Looking forward to hear from you and have you join the conversation. We were talking about the future in spite of, we've looked at the challenges.
Yes.
Is there light at the end of the tunnel?
Yeah, the future starts now. And Nigeria has a huge population of young people that are waking up and saying enough is enough to corruption. Enough is enough to bad leadership. And we are ready to take on responsibility to grow our future with knowledge, attitude, and technical skills. Forums are shaping up on WhatsApp. And people are thinking about how to grow Nigeria out of poverty. People are putting structures and systems in place to link groups and individuals to self-support mechanisms. These are clusters for now, but they need to bounce up and blow out. Government need to recognize this and create a forum for the various kernels of opportunities that are growing among young people to come together as a hub for future development. It is doable. The time to do it is now. Some of us that have been in the mainstream of helping build capacity of young people are still willing to lend a hand. But the forum for that to happen has to be created. The hub as instrument to catalyze development has to be created. The political institutions should recognize that this has to happen and it must happen, so that our youth, young people who are far above in terms of thinking for development and future looking can be given the opportunity to express themselves. If we don't do that, a time will come when the youth will take matters into their hands, and we don't want that to happen.
Yes.
The song we just played now says, let us come together and look at what we can do and what we must do as members of the same family, and do it the best way that ought to be done. there are many lessons learned in the development sector. There are reports, there are studies. This need to be dusted and given to people to say, hey, what sense can we make out of this? And create a pathway for future growth and development for Nigeria. Let's look at Nigeria in the next 10 years. Where do we see ourselves? In the agri sector, in the health sector, in the education sector, in other sectors. We must create sectorial hubs for people to fit in and create think tanks, people who are thinking strategically and looking into the future and say, hey, how can we turn this, our challenges, into our opportunities for growth without looking back to depend on donor funding. The time has come for Nigeria to walk away from conscious development aids and look inwards to build its own internal mechanisms to raise funding and support development. It's practicable, it's doable, and the time to start it is now.
I like to be very practical.
Yes.
What are the next steps? Who will mobilize and begin this move? Is it the same government and her institutions that in one way or the other have pushed the wrong buttons that have led us where we are, in part? Or indeed, we can also take a peep at the private sector. But in all of this, quickly, put light on the role of the private sector in terms of funding for development.
Yes, the private sector...
Can they play a role?
Yeah, they do. They have a corporate social responsibility to support development initiatives in the communities where they are working. And not only just the private sector, even the oil and gas.
Okay.
These are instruments that have funding put in place that can support development initiatives. It's time to bring them together. Working with non-governmental organizations and their various networks and say, hey, let's tap into these initiatives at the private sector, the oil and gas, and the industrial sectors, and see how collectively ideas for growth and sustainability can be fashioned for the future of Nigeria.
Okay.
And NGOs and their networks need to come together. NGOs, CBOs, and business membership organizations need to come together.
Do you see this coming together? NGOs, organizations often are seen working independently, doing their own planning independently and all of that. Would coming together, partnership between different NGOs, INGOs and corporate organizations, government agencies coming together, would it be of benefit and help fast track this movement in the right direction?
Exactly. The time to institute partnerships among the various entities looking at creating opportunity for the growth and development of Nigeria is now. I don't know where it's going to start, but somehow it has to start. I believe in partnership. The various NGOs and CBOs and INGOs need to come together collectively and say, hey, what can we all bring to the table as creative ideas that can stimulate development interventions for Nigeria? Sustainable development initiatives for Nigeria. Everything in life starts from an idea, a thought.
Indeed.
Once a thought is put on the table, you can never tell how far it will grow when it is rubbed with minds that are thinking alike.
Indeed.
Any institution that ever existed, it existed in the minds of one person or two who thought about it. And I think what you are doing now in this Health Connect is the beginning.
Thank you, sir.
You can megaphone for the various entities I just mentioned
Indeed.
to come together and find a meaningful, logical way to put a framework for growth of Nigeria. And I'm happy to be part of this. Call upon me when it's going to happen.
Thank you so much, sir. Well, I wish that we had all the time, but let's quickly take advantage of this call that you have made now. This program, Health Connect Forum, is there for you, and the time is now. In fact, the best time was yesterday.
Yeah.
Was 5 years ago, and the next best time is now. So get in touch with us. Reach Out Health Awareness Foundation, ROHI, popularly known as ROHI, is open for partnership, and our doors are wide open. You can get in touch with us by simply going to our website, that is www.reachoutwithhealth.org, or call 0703 044 8318. And we'll talk with you, and most importantly, give you this platform to talk about your projects and programs and possible partnership on how we can work together for the overall good of our people. Our guest this morning has been Mr. Joshua Ida Sampson. He is an expert. He is a strategy management and development consultant. This conversation, I'm not sure we would finish in one episode of this program. Well, as you've said, when we come knocking on your door again, we trust
yes,
it will open for us, and we'll tap into your wealth of experience and provide the right information and support that is needed, not just by the community, by also industry operators.
Exactly.
Thank you so much, sir. But before we let you go, a final word to everyone who's listening and those who are in the development work, looking for light somewhere and anywhere.
My parting word: we must take our future into our hands as Nigerians. We have what it takes to make it happen. We need to be courageous to engage with various partners and opportunities that we can create, and with humility and logical intention, work together as a team to make our life good for our children. The time to do it is now. No blaming, because what is past is past. Our leaders maybe have done what they did because that was their orientation that time. We now have a new orientation that is thinking futuristic. And we believe that when our thoughts come together, we can move any mountain along our way.
Sure.
Thank you, Nigeria.
Thank you so much. And to you, our listener, thank you so much for being a part of the program, Health Connect Forum. It's been a brilliant conversation so far and an eye-opener, trusting that in the days ahead, the table of partnership will be filled round and serious conversations that will advance and point us in the right direction will commence. Thank you so much for being a part of the program. We appreciate the Municipal FM team and the AMAC Community Radio team. Thank you so much. And to ROHI, Reach Out Health Awareness Foundation, ROHI, thank you so much for making this platform available. Please do also take advantage of it. Call the phone number 0703 044 8318, or go to the website reachoutwithhealth.org. reachoutwithhealth.org. My name is Imo Ebong. I'm your host. Until same time next week, Wednesday. God bless and goodbye.
Digital voices carrying truth, turning myths around, breaking old harmful rules. Reproductive rights, a safer choice. Health promotion that gives people a voice. One clear fact, one open mind. That's how change begins to unwind.